Our last lecture of the semester is going to focus on problems and issues that many teenagers deal with, as well as resilience, or the trait that we see that can protect teenagers and emerging adults from experiencing or being negatively impacted by problems. Lecture video 1 will focus on externalizing problems. Lecture video 2 will focus on internalizing problems and resilience. So to get started, let's spend just a minute talking about these two big terms for the week. An externalizing problem is a problem that affects an individual's external world. I like to think about externalizing problems as behaviors that create issues for an individual, such as fighting, delinquent type behaviors, or risky sex behaviors. On the other hand, many of the problems that we experience that are related to our psychology are internalizing problems, or those issues that impact a person's internal world. I like to think about internalizing problems as mental states, like anxiety, depression, or anger. Before we dive a little deeper into internalizing and externalizing problems, I do want to mention that these two categories do not necessarily occur independently of one another. It is possible to experience both internalizing and externalizing problems, and in fact, that is not uncommon. So let's dive into externalizing problems. One of the primary features of externalizing problems is the personality trait of being under-controlled or lacking self-control. Individuals who tend to be under-controlled are at greater risk of experiencing or demonstrating externalizing problems. We know that some other variables that contribute to the occurrence of externalizing behaviors are low parental monitoring and control. So a parent who isn't involved enough in their child's life or provides their child with a little bit too much freedom during adolescence and even to some extent during emergent adulthood. We also know that being male does predispose someone to being more likely to experience externalizing problems. But I want you to keep in mind that some of that is likely due to socialization rather than biology. The way that we encourage males to cope with negative experiences, being tough, sucking it up, often put them at a risk for externalizing behaviors, like engaging in a fight. Lastly, I want to mention desire for excitement. Individuals who have a strong desire for stimulation or even engaging in risky, thrilling events are more likely to show externalizing problems as well. You can think of this as thrill-seeking. Thrill-seeking, of course, leads to some of the problems that we're going to talk about today. The first specific externalizing behavior that I want to mention is driving. Unfortunately, accidents occurring while driving is the #1 source of death for adolescents and emerging adults in America. In fact, individuals aged 16 to 24 have the highest rate of auto accidents, injuries, and fatality. Anyone who has or has had a teenage driver knows that their insurance goes up dramatically when they add a teenager to their plan. This is because insurance companies know that teenagers are at a higher risk for these problematic behaviors. We also know that some of the cognitive biases that are associated with adolescence that we've talked about in the past, particularly personal fable or the belief that you're the one in a million, that risk and consequence doesn't apply to you, makes it more likely for teenagers to engage in dangerous behaviors. Young drivers are more likely to speed, to drive recklessly, like tailgating another driver, to violate signals and signs while driving, stop sign, red lights, speed limit signs. They're also more likely to engage in risky lane changing and drive while under the influence. Again, a lot of this comes back to that cognitive bias, that those consequences happen to other people, not me. But these also have to do, or are more common in individuals who have that thrill-seeking component to their personality. Unfortunately, teenagers are also less likely to wear a seatbelt, which puts them at even higher risk of fatality when they do experience an accident while driving. So I want to spend a minute talking about what we can do to keep our young drivers safer. You may or may not be familiar with graduated driver's license systems. I was raised in Tennessee. I lived in Nashville when I turned 16, and my learner's permit, or I guess when I turned 15, I got my learner's permit. That was the first step of Tennessee's graduated driver's license program. I can only drive with a parent in the front seat. After that, I received the next level of driver's license where I could only drive with, I believe, a sibling in the car with me. After that, I could drive with 2 friends in the car, and then after that, it was unrestricted. That's how graduated driver's license systems work. And they've actually been proven to be the most effective method to prevent dangerous driving during adolescence. You might have thought that driver's ed goes a long way towards preventing automobile accidents, but unfortunately, we know that many times the opposite is true. Driver's ed programs can actually put teenage drivers at a higher risk of experiencing automobile accidents. Driver's ed is boring, so they're not really paying attention while they're learning. That coupled with that personal fable is a dangerous combination. Driver's ed in some countries and states allow for teenagers to get licensed earlier, so before they might be cognitively, behaviorally ready. And then driver's ed also tends to increase confidence, which actually makes that personal fable even more difficult to overcome. You can think of that as the optimistic bias that we talked about. I know everything, it's not going to happen to me. So this isn't to say that driver's ed cannot be effective, but on average, it does tend to increase the chance of risky externalizing driving. The next externalizing behavior that I would like to talk about is substance use. Substance use is the use of any substance, alcohol, cigarettes, or illegal illicit drugs to alter cognition and mood. So again, this includes things that are legal, alcohol, cigarettes, prescription medication, and illegal drugs as well. Anytime we are using a substance in order to change how we're thinking or feeling, we are engaging in substance use. And of course, none of these substances should be used, with the exception of prescription medication, of course, or over-the-counter medication at the advice of a doctor. None of these should be used by an adolescent. Their brains are not done developing, and use of substance harms the development of that prefrontal cortex. It is not a good idea, ever. We know that there's 3 primary reasons that teenagers and emerging adults report using substances. Oftentimes, they try things out as an experiment just to see what it's like, see what all the fuss is about. Many adolescents also report substance use for social reasons, as well as medical use, or what we refer to as self-medicating, doing it intentionally because they want to feel differently. We know that medical use holds the highest risk of substance use becoming a bigger or more permanent problem. Interestingly enough, we know that substance use peaks or increases during emerging adulthood. So individuals in those later years of our focus are actually more likely to engage in substance use. We see this as a combination or kind of a double whammy of propensity, or kind of the tendency to want to engage with it for the 3 reasons we just discussed, coupled with increased opportunity. Emerging adults also tend to have more unstructured socialization, which we've talked about in the past. We've talked about how that increases problems at school. This is another area where we do see a negative outcome of having unstructured time. Generally speaking, when it comes to substance use, having oversight by parents or an adult, parental monitoring, can go a long way towards preventing teenagers from engaging in substance use. But sometimes, when there's family conflict contributing to a child's desire to engage in substance use, addressing those family problems can be very beneficial as well. Our next externalizing problem is delinquency. Delinquency is any violation of the law by a juvenile or a person under the age of 18. And we actually tend to see delinquency taking 2 different paths when it comes to adolescents: life course persistent or adolescent limited. We'll revisit those 2 definitions in a minute. What I want to focus on is this statistic. Most crimes are committed by men between the ages of 12 and 25. This is the highest risk period when it comes to breaking the law or, of course, engaging in delinquent behavior. And there's two primary reasons for that. One is the amount of time that men in this age period spend with peers, as opposed to at work or in more structured environments. A lot of that has to do with gender norms, as we've talked about in the past, where they start to engage in delinquent behaviors because they think it's the right thing to do socially. However, we know that delinquency also increases when a male has a larger desire for thrill seeking. So excitement and sensation seeking tend to peak during this period as well, which contributes to delinquency problems. As I mentioned, there are two different trajectories that delinquent behavior tends to take, and the first one is the most troubling. Life course persistent delinquency is when an individual has a history of behavioral or criminal problems prior to reaching adolescence and then continues those patterns of behavior once they've reached adulthood. We know that individuals with life course persistent delinquency tend to have comorbid situations or other behavioral and or psychological issues as well. Neuropsychological deficits or ADHD being two of the common. And like I mentioned, these individuals are at the greatest risk for negative lifelong outcomes. Being from a high-risk environment is a variable that impacts this both directions. High-risk environment increases your chances of becoming a life course persistent delinquent and having many of the other associated outcomes as well. On the other hand, some teenagers only show delinquent behavior during adolescence. Adolescent limited delinquency is when we don't really see any warning signs before the teenage years, and once the person reaches adulthood, those externalizing behaviors tend to go away. And like I mentioned, that one tends to be associated with fewer negative long-term outcomes. When it comes to preventing delinquency, we know that engaging the adolescent or emerging adult in both individual and group-based or even family-based therapy can be very effective to try to address some of those underlying causes. However, targeting that unstructured socialization aspect of this, getting that individual into vocational training can be very helpful as well, which allows them to have mentorship and develop a lifelong skill to get them out of that high-risk environment. Unfortunately, we know that many of the solutions that are often used to address delinquency involve putting the adolescent in a group with other delinquents. And when that happens, we often see an increase in delinquent behavior for everyone in that group. We call this peer contagion, an increase in delinquent behaviors that happens when you're spending time around other delinquents. So unfortunately, many group-based programs, rather than preventing or lowering the risk of externalizing problems, actually increase the negative outcomes for that individual. An alternative approach is something called a multi-system approach, where instead of just putting that delinquent in a different environment, we actually address all of the aspects of the environment that might be contributing or could be utilized to help. For example, home-based interventions, family therapy, school-based interventions, maybe getting them involved with an older mentor or prompt them to start participating in extracurricular activities. Neighborhood approaches, for example, building a neighborhood youth sporting complex in a neighborhood. And then, of course, individual therapy needs to be incorporated as well. Oftentimes, multi-system approaches involve both parent and job training, addressing two different aspects of that center. And then, as I mentioned, youth centers and athletic groups tend to go a long way towards lowering the risk of delinquency. So I want to end by talking about some sources of externalizing problems. We know that externalizing tendencies don't just come from an individual, but they also don't just come from the environment. Some of the socialization aspects of this tend to be trouble in the family structure or family processes. So having parents at home versus not, and then the ways the family communicates and problem manages together. Parenting style, of course, plays a big role here, but so does friend influence. Like I mentioned earlier, we can see some pure contagion popping up when an individual gets involved with other externalizing individuals. The type of school system and neighborhood that an individual is raised in can either be protective or a risk factor. And then we also need to concern ourselves with the type of media that a teenager is consuming. On a more macro level, we also need to worry about the legal systems. How does the law impact a child's life? Because sometimes the behaviors that might start off as small can escalate when the legal system interacts negatively with an at-risk child. Of course, that does not always happen. Sometimes legal intervention can be very beneficial. It often depends on the neighborhood, the community that an individual is raised in. Cultural beliefs can also play a role when it comes to dictating what norms and what behaviors are considered abnormal. But on an individual source, we know that gender plays a big role. Like I mentioned, males are more likely to experience externalizing problems. Ethnicity has shown to correlate with externalizing behaviors, but much of that comes from SES or socioeconomic status discrepancies within our country. Being generally more aggressive increases the chance of externalizing problems, as does sensation seeking, like we mentioned, difficulty with cognition and impulse control, as well as that optimistic bias that we addressed earlier. That brings me to the end of video 1. Video 2 will pick up by looking at internalizing problems.